Feeling?
You know, I'm actually feeling great. I'm almost a little surprised of how great I'm feeling, although I do understand that there'll be a cumulative effect. But I started the chemo right away. I thought it was very important to not be paralyzed, but to jump into action, get a lot of opinions, which can be very confusing, and put a team together. And that's what I did. So I've been very proactive.
Yeah.
And that's put me in the right frame of mind.
And you're known for that. I mean, with your healthy living and your advocacy around these issues. I want to talk about some of the confusion you described in a second, but how did you hear? How did this all sort of transpire? Did you get a phone call ultimately after the exam, or what happened?
Nope. I get my mammogram every year, and as soon as they started doing 3D mammograms, I paid the extra money and got that, even though it's not covered by insurance. I figured go for the best. And I was told years ago that I have kind of dense, fibrous breast tissue, like a lot of women do, and that makes it very difficult to see things in a mammogram, and that I should always follow it up with an ultrasound. So, you know, this year I came out of my mammogram and they said, you're all clear. And I'm like, oh, happy-go-lucky, one more year I beat it. Even though I never really expected to get it, but you always hold your breath. Every woman holds their breath, not just while the mammogram's happening.
Yeah.
We hold our breath in the lobby and while we're waiting. And the ultrasound, she kept going back to one spot. And so they brought in the radiologist and they said, you need to do a core biopsy. And so they did, and they said, we'll have to send this out. And so my husband went back with me. And I knew the minute the doctor walked in the office. You could just tell by her demeanor. And she said, you definitely have breast cancer. And I immediately went to a cancer surgeon that she recommended, and that my gynecologist, I called a few places, got a recommendation so I could learn more. And by the time I got to her, then I learned what the pathology was. And I learned that I'm something called triple negative. So this didn't come about from estrogen or progesterone, or is it the HER2? This is kind of a subset. One thing I learned is that breast cancer, you think of it as one thing. Every woman has a different kind of breast cancer as far as how the pathology comes out, where it is, and you really need to get a lot of opinions, which is scary because these brilliant doctors sometimes disagree with each other.
Right.
But you have to, at some point, put yourself in the hands of a team and decide what's best for you. And I want to make this clear, because I mean, I've got so many thousands of people writing to me on Twitter and Facebook. What I say I'm doing doesn't mean that that's what you should be doing. You can't do exactly as your mother did, or your sister did, or your friend did, because every woman's breast cancer is different.
You know, one thing, again, and this is more of a psychological question, I remember my mom went through this. One of the things she said to me was that she wondered if she had done something wrong.
Yes.
To bring on the breast cancer. And it was a heartbreaking thing to hear from her, because you know, how can you be blaming yourself about this?
But I think most women do. I think we say we must have done something wrong. And it was compounded for me, because I was afraid if I come out with this, everyone's going to say, oh, sure, she's a health advocate, and look, then she goes and does this to herself. But one thing I've learned is that these things just happen on their own, especially mine being triple negative. I don't know if they completely even understand how it comes about, because it's not fed the normal ways through hormones. And I was scared that that people would think I let them down, and that made coming out with it. But I'm going to be perfectly candid. In the first 2 days or so, I just wanted to like go away somewhere and not let anybody find out. I also felt like I didn't want to tell the kids, because my younger kids would be worried. But we were advised by everyone that that was really a mistake. And my husband knew it was a mistake. He owns summer camps for children, and he always says to the parents, you need to be honest. Keeping family secrets bring up trust issues later in life. But my little ones are little. I mean, I have twins who are 11 and twins who are 9. So you do it in kind of an age-appropriate way, and they seem to be doing well with it. Fortunately, I was able to end that conversation with, because I caught it early, my prognosis is excellent. So while I'm going to have all this medicine and a surgery. By the end of the year, it'll be gone.
Wow. Well, Joan, I am so delighted that you join us and talk about this. And there's so many fans out there. And after all these years, we're still getting great advice from you. So I really appreciate it.
Thanks.
Thanks for being here.
My pleasure, Sanjay.
And I want to turn now